Here we are, the middle of allergy season. You probably know that. We can hear the sneezes and sniffles throughout the station. Today we have the chair of the primary care department at KCU, Dr. John Paulson, to give us some tips and insight on coping with allergies. Who in the world doesn't have an allergy right now? It's crazy.
It is, it is. Well, right now we're talking about seasonal allergies,
right.
And today it is oak pollen and probably walnut pollen. And so the way allergies work is that pollen is in the air, and as you breathe that in through your nose, it settles on the lining of your nose. And with that, it causes irritation. And then your nose does what it's supposed to do. It kind of swells up and produces snot and mucus, and so you start with runny nose. And if it's not draining out the front, it's draining down the back, and you got a little bit of that.
That's the bad part, yeah.
Right? And then if you're not able to clear your throat, it drains down and irritates your lungs, and then you get the cough. And then the sneezing and itchy eyes and all that stuff comes with it.
It's just snowballs, this whole thing, and it's all because these little tiny particles came into our nasal cavities.
Exactly.
So what do we do to avoid all of that as well as we can?
Well, you know, most doctors recommend medicines, but with allergies, we try to start around that, right? And so one of the great things that we can do to start with is knowing how it starts. We use things like the neti pot or the Neeley Med nasal rinse, and what that does is doing that once or twice a day washes all those particulates off the lining of your nose, and so it reduces the inflammation and the drainage and that kind of stuff. And that's a great place to start doing that, especially this time of year when you can swipe the pollen off of your car. After that, the next step is, you know, Benadryl, Claritin, Zyrtec, those type of antihistamines, and or nasal spray like Flonase and things like that. And those both work about the same, except for the fact that nasal spray actually works a little bit better for itchy, watery eyes.
Okay.
And so you can use one and or both, but that really is kind of your primary defense for allergies up front once you have the symptoms.
I have been a proponent of the neti pot for about 15 years, and the first 2 days you try it, you're going to hate it.
Yes.
Right?
Yes, that's right.
But day number 3, you're not ever going to hate it anymore, and you're going to kind of get used to it. There's some information on your screen right now. These can turn into a chronic sinus infection.
Exactly.
Fairly easily. So how do you know when it's not just the seasonal day-to-day stuff and you start to get infected?
You know, this time of year we've been, you know, right now flu's on the coming down, but we have kind of hay fever and that kind of stuff. So when you have these symptoms and you treat for a few days and you're not getting better, and or if you're developing fever or chills, that's really your warning sign. When you're doing this stuff, most people, if you have allergy type symptoms, spring or fall, you kind of know what that is. But the warning signs you're looking for are fever that persists more than a couple days, any kind of shortness of breath or breathing. This can certainly be complicated with allergy type things. Shortness of breath is always something that you want to see your doctor for. Those are the primary things.
One thing I want to circle back to, and that is the Zyrtec and all of the allergy medicines out there. You don't take those and immediately get a result, do you, or can you in some cases?
No, actually they take a little bit of time to build up in your system, and when you look at Benadryl is the strongest, but it makes you the sleepiest. And then you have Claritin, Allegra, those are kind of a little bit less sleepy. And so a lot of folks during this time of year will start with those as a prevention. And one of the things you can actually do is this time of year when you're outside mowing and that kind of stuff, sometimes folks that have really significant allergies will actually wear one of the N95 masks and then come in and do the rinse, and a lot of times that'll really reduce your symptoms.
And that way you don't have to take all of the drugs or maybe even eventually the injections that some people do.
Exactly.
Great advice. If you want to know more about allergies or anything medical related, we are so fortunate to have KCU in our area, and thanks so much for coming in to bring us up to date on this allergy season. And we were talking right before we went on the air, everybody this year and every single year in
worst allergy season.
Worst allergy season ever. And so that's going to happen next year too, isn't it, Doctor?
And in the fall.
Yeah, right. Thank you so much.
You're welcome.